Rickets is a disease that is characterized by the softening and weakening of bones in children, most commonly seen in individuals between the ages of 6 to 24 months of age. Oftentimes, it is caused by prolonged deficiency of vitamin D, a vitamin that is essential when it comes to absorbing calcium and phosphorus from the gastrointestinal tract. There are three types of rickets that should be recognized: nutritional rickets, hypophosphatemic rickets, and renal rickets. Vitamin D deficiency can come about from a variety of factors, such as geography or a lack of receiving adequate amounts of foods and beverages that are fortified with vitamin D. Nutritional rickets, also known as osteomalacia in adults, is caused by vitamin D deficiency. Vitamin D is a fat-soluble vitamin and is necessary for forming and maintaining healthy bones and teeth, as well as absorbing calcium and phosphorus from the gut. Vitamin D is synthesized by the skin cells in response to the exposure of sunlight and is actually quite difficult to get from natural foods. If not enough vitamin D is consumed, the body cannot absorb calcium effectively, which can lead to rickets. The second type of rickets, hypophosphatemic rickets, is caused by low levels of phosphate. As a result, the bones can become soft and pliable and therefore more susceptible to fractures. Research has shown that this type of rickets is genetically linked, and it differs from nutritional rickets because it is not caused by vitamin D deficiency. The body can absorb phosphate and calcium, but rather there is a defect in the kidney's ability to control the amount of phosphate that is lost when urinating. The third and final type of rickets is called renal rickets, and is developed as a result of certain kidney disorders. Similar to the previous type of this disease, renal rickets is caused by the body's inability to control the amount of specific minerals that are lost in the urine. In this case, the body has a decreased ability to control the amount of electrolytes lost while urinating, such as calcium and phosphate, both of which are needed to maintain healthy bones. In this presentation, the focus is going to be on nutritional rickets, which is the most common type within children. In terms of what causes nutritional rickets, the cause is pretty clear. It is a deficiency in vitamin D and usually comes about due to an extreme and prolonged vitamin D deficiency. Vitamin D aids with the absorption of calcium and phosphorus from the gastrointestinal tract. A deficiency of this vitamin makes it difficult to maintain healthy calcium and phosphorus levels within the bones, which causes rickets. Vitamin D is a fat-soluble vitamin and is actually present in very few foods. It is found in higher amounts in fish, liver, and egg yolk, and is added to many products that we consume on a daily basis, such as milk, orange juice, and margarine. It is also a pretty unique vitamin. It's produced naturally within the body when the skin is exposed to sunlight. There are 5 types of vitamin D: vitamin D1, D2, D3, D4, and D5. For humans, vitamins D2 and D3 are the most important types in terms of what we should be receiving from our diet. Chemically, the structure of all 5 types of vitamin D is very similar. All of the forms of vitamin D are called steroids, meaning that they have the same molecular structure as steroids. However, one of the bonds between the steroid rings is broken. The vitamins D2 and D3 vary slightly. A vitamin D2 molecule contains a double bond between carbons 22 and 23 and a methyl group on 24, whereas vitamins D3 does not contain either of these characteristics. The most significant benefit that vitamin D provides to the body is healthy bone growth and maintenance. Vitamin D plays a significant role in the prevention of diseases such as rickets and osteoporosis, both of which result in the deterioration of bone tissue, which can in turn lead to a bone fracture and other health issues. New research also shows that vitamin D plays a role in many other bodily functions, such as helping the immune system to fight infections, improves muscle and cardiovascular functions, and aids with brain development. Like with many other chemicals that we ingest, too much of this vitamin could result in a negative consequence. Although it is very difficult to achieve, there is a such thing as vitamin D toxicity. If too much vitamin D is consumed, the liver produces large quantities of a specific chemical, which in turn can raise calcium levels within the blood. This condition is called hypercalcemia and rarely occurs as a direct result of ingesting too much vitamin D. There are various telltale signs and symptoms that are associated with rickets. Generally, there are commonalities between the majority of those that have the disease. These common signs and symptoms include delayed growth, pain in the spine, pelvis and legs, muscle weakness, and easily occurring bone fractures. Rickets is also known to cause skeletal deformities, such as bowed legs, thickened wrists and ankles, and breastbone projection. Rickets is much more prevalent in people with darkly pigmented skin due to the fact that the chemical melanin acts a certain way to attempt to block sunlight. However, this also inhibits the skin's ability to make vitamin D. This includes children who originate from Asia, Africa, and Middle Eastern countries. The likelihood of developing rickets also increases the further away from the border that you live due to the decreased intensity of the sun. Similarly, it also occurs more commonly in areas that have little exposure to light. Recently, there's been an increase in ricket cases in countries such as the United Kingdom, and research suggests that this is because children are not playing outside enough, and it could also be attributed to a poor diet. All in all, rickets is much less prevalent today due to the fact that many of our everyday foods are fortified with vitamin D. However, vitamin D insufficiency is on the rise once again. Studies show that approximately 30% of all U.S. children are vitamin D deficient to some degree, and this statistic increases in other regions around the world. Another factor that may contribute to the rising number of rickets cases may in fact be that people are more aware about the dangers of being in the sun for too long. Sunlight is essential for us because our bodies need it to make vitamin D. However, many people use sunblock or try to avoid the sun altogether, which can inadvertently lead to the development of rickets. Here's a little known fact. Rickets has been around for a very long time and was even more common in the past than it is today. In Victorian England, this disease, along with others such as tuberculosis and gout, was common in a large portion of the population. It wasn't until 1919 that the cause was discovered, and doctors began using UV lights as an alternative way of synthesizing vitamin D within the body. In the 1940s, certain foods such as margarine and milk were fortified with vitamin D with the intention of reducing the prevalence of the disease, which shows how much of an issue it once was in society. Luckily, rickets is easily preventable. Children need to maintain a balanced diet while spending time outdoors. It is recommended that children receive 10 to 15 minutes of natural sun on the hands and face a few times a week, which, when you think about it, really isn't that much. While exposing children to sun, it is very important in terms of meeting the requirements for vitamin D intake. But it is equally important to keep in mind that excess sunlight exposure can result in sunburn or eventually skin cancer. But 10 to 15 minutes a day without sunscreen won't do any harm. When it comes to testing for the disease, there are several fairly simple tests that a doctor may perform if they suspect that a child has rickets. These tests may include blood tests of calcium and phosphorus, and bone x-rays, and in very rare circumstances, a bone biopsy may be performed, which involves using a needle to remove a small section of the bone, which can then be later analyzed in a laboratory. In general, rickets is a relatively simple disease to treat and cure. On rare occasions, some bone deformities will remain, however most will fix themselves with time. Most of the time, a doctor will recommend that the patient increases the amount of time that they spend in the sun and to try and eat more foods that are rich in vitamin D, such as fish, milk, and eggs. In some circumstances, vitamin D supplements may be taken. All this goes to show the importance of various minerals and vitamins. No matter how small and insignificant they may appear, these nutrients are essential because they keep us healthy. In terms of rickets, it is not a very common disease, but is still very important to consume enough vitamin D to not only keep us healthy now, but to also keep our bones strong and healthy for the future.